everyone. Today I will discuss about a very important topic which is mostly important as well as for our country and also our community. The name of the topic is care of adolescent. Adolescent people is the more vulnerable group and they are more prone to develop any kind of disease both physically and mentally. So the care of adolescent people is very much important. So today I will discuss about care of adolescent. Adolescent phase is the phase of human development encompassing the transmission from the childhood to adulthood. Adolescence is the transition phase. It is from begin from childhood and end to adulthood. That means in the middle phase of childhood and adulthood, the phase is called adolescence. The age period of adolescent people is between 10 to 19 years for both sexes. Health services for young people include mental health services, drug and alcohol services, sexual health services, injuries, violence, tobacco use, etc. Health service of adolescent people is very much needed because of in case of adolescent people, they are more vulnerable to prone any kind of disease condition. So at first we will know about the definition of adolescent people. Adolescent phase is the phase of human development encompassing the transmission from childhood to adulthood. That means adolescence phase is the transition phase, or we can say it is the middle phase of the childhood and adulthood. Okay. The age period of adolescent people is between 10 to 19 years old. It is very much important to know about the age period of adolescent people. So, the age period of adolescent people is 10 to 19 years old. Okay. Then we will discuss about the stages of adolescent. There are three phases or three stages. At first, early adolescent, middle adolescent and late adolescent. In early adolescent phase, it is considered as the people who is between the 10 to 13 years old. In the middle adolescent, it is 14 to 16 years old. And in the late adolescent, it is 17 to 19 years old. This 3 point is very important. You people should keep this point on your mind, okay? Then adolescent health is vulnerable. Previously I have said that adolescent health is more vulnerable to prone develop of any kind of disease like physically, mentally, etc. So why the adolescent health is more vulnerable? We will know this topic. The following factors are responsible for this condition, like number 1, major physical, psychological and behavioral changes take place in the phases of adolescence. Like that means in the cases of adolescence phase, like 10 to 19 years old. In 10 to 19 years old, our growth and development is more likely to develop. Like this apart for this condition, it is said that major physical, psychological and behavioral changes take place. Then number 2, sexual maturity and onset of sexual activity. Then development of adult mental process, like this is the condition of psychological condition. And then menstruation. In this period of phase, menstruation phases begin. Okay. So in this reason, adolescent health is more vulnerable to develop any kind of disease. Then growth of adolescent people in various aspects. Okay, at first we will know about physical growth. In the cases of physical growth, there is at first weight gain and then increase in adipose tissue in girls and then increase muscle mass in boys. So in the cases of skeletal growth, secondary growth start 25% of adult height. So you can see 25% of growth is occurred in the phases of adolescent. So a big portion of skeletal growth is occur here in the phases of adolescence. And in the cases of body composition, weight gain is occur, increase in adipose tissues in girls and increase in muscle mass in boys. These are under the category of physical growth. And then psychological growth. Psychological growth, at first mood swings. Mood swings is a very common incident in case of adolescent. Like in case of early adolescence, mood swing is happen more oftenly. In the case of late adolescence, mood swing happen but less often. But early adolescence is a very dangerous phase where mood swings are happen. So swings, then less interest in parental activities. Okay, and intense relationship with same and opposite group of people. Okay, so these are the aspects of psychological growth. And then sexual growth. Sexual growth, and at first boys, in cases of boys the sexual growths are breast birth 8 to 12 years, development of pubic hair in 11 to 14 years, menarche in case of boys and in case of girls. Okay, so I previously told that that is a mistake in case of girls. At first I will say in cases of girls. In cases of girls, breast birth 8 to 12 years, development of pubic hair in 11 to 14 years, menarche by 9 to 16 years, enlargement of ovaries, uterus and clitoris. Okay, and underarm hair by 13 to 16 years. Okay, so after that we will discuss about the sexual growths in boys. In cases of boys, testicular enlargement by 9 years, development of pubic hair in 10 to 15 years, enlargement of larynx, pharynx and voice break. Okay, there is a common condition in cases of adolescents boys, the voice change is occur. Like the voice become heavier in cases of adolescent boys. So voice change occur in this period because of the enlargement of larynx and pharynx. And then weight gain and increase muscle mass by 11 to 16 years old. These are all aspects of growth and development in cases of adolescent people. Okay, there is the picture of mood swings. Here you people can see one boys he smile and a few after later he can cries, mood off, etc. So mood swings is a very common problem in the adolescent people. Then adolescent health problems. Okay, here we will discuss about adolescent health problems. The problems are subdivided into some categories. At first, nutritional problem. At first, undernutrition leads to anemia, impaired growth. Okay, in cases of toddler, kwashiorkor marasmus are happen due to the protein deficiency. In cases of early adolescence, kwashiorkor marasmus also can happen due to the protein deficiency. Apart from this, undernutrition can lead to the development of anemia, impaired growth, development, etc. And then obesity is a common problem. And then eating disorder. Eating disorder is a very common problem in the cases of early adolescence. And in cases of undernutrition, anemia is developed, but iron deficiency anemia is more common. The prevalence in adolescents of iron deficiency anemia is 22 to 80%. Okay, so nutrition problem, under the nutrition problem there are anemia, impaired growth, eating disorder, obesity, etc. Then reproductive problem. Under the reproductive problem, there is irregular menstrual cycle. In cases of teenage girls, it is a common problem. Early adolescence, middle adolescence and also late adolescence, it is a common problem, irregular menstrual cycle. Next, teenage pregnancy. Teenage pregnancy is a most common social issues. Teenage pregnancy is a very dangerous social issue. So it is also common problem in the reproductive cases. Next, genital tract infection. It is also a common problem. Then mental health problem. In the cases of mental health problem, there are depression and suicidal tendency. It is seen in the cases of middle and late adolescence. Depression, tension, and from depression and tension anxiety occurs, and from anxiety suicidal tendency also occurs. Then the mania, what is mania? Mania refers to a syndrome in which the people who suffers from the mania are strict in his condition, and overactivity, overthinkingness is occur, so it is called mania. Then psychosis, any other psychological disorder. Then the behavioral disorder. In the cases of behavioral problem or behavioral disorder, there are substance abuse like drug abuse, alcohol abuse, smoking, etc. These are very common problem in the adolescent people, and the rush driving, violence behavior, etc. So these are the aspect of the adolescent health problem. I hope you people can understand about the adolescent health problem. Then we will discuss about preventive measures of adolescent health problem. There are three types of prevention, like primary prevention, secondary prevention, and tertiary prevention. What is primary prevention? Primary prevention is a kind of prevention which we should take before the appearance of the problem, that is called primary prevention. And secondary prevention, after appearing the problem, we should try this kind of prevention for solve out this problem. And secondary prevention is effective because early cases of problem, that means when the problem start, then as soon as possible we can start in this kind of prevention. This is called secondary prevention. And when the problem is started and we start our preventive measures late manner, it is called tertiary prevention. So at first we will discuss about primary prevention. In the cases of primary prevention, we should provide a healthy lifestyle to the adolescent people. Lifestyle Healthy lifestyle, that means family support, friend support is a healthy way lifestyle. And proper communication, parents should be communicate with their child with a friendly manner, and restriction should be avoided. Friendly behavior should be adapted to the child. Proper communication should be maintained. Child should be time. Parents should give the child proper time. Okay, proper communication should given. These that's why a healthy lifestyle can be created. Then secondary prevention. In cases of secondary prevention, screening program for visual and oral health problems and learning disorder. If visual problem and oral health problem can seen, so we can arrange a preventive program or a screening program. That means we can find the people who are suffering from this problem, and if we can find those people, we can assess them and started treatment them. Okay. And learning disorder. Then guidance and counseling are very much important in these phases of life, like adolescence phase. Guidance is very much important for these types of people. And then in the cases of tertiary prevention, increase the level of education should be increased. And rehabilitation is the last phase. Rehabilitation can be started. Okay, so I hope you people can understood in the prevention of health of adolescents. Okay, so today I have discussed about the stages of adolescence, the definition of adolescence, why they are vulnerable, and growth and development feature of adolescent health problem, and prevention of health problem of adolescence. Okay, so most adolescents are thriving, but they are vulnerable for any kind of disorder. So we should take care the adolescents people as much as we can possible. Adolescents health is very much important in our country as well as in our society. So thank you, group.